making of men's health. So this is me pulling together all the things that have been discussed this week, but mainly focusing on our really significant areas that we need to think about, what's very important in men's health. And I'm going to explain why I believe that I've focused on these particular things. So let's start. You know, everyone knows I'm a researcher, can't help myself, have to start with some stats. So I won't apologise for that. But if you haven't been convinced by some of the speakers of what's happening in our world as far as men's health, I hope some of these diagrams will help you understand this. So if we look at this particular diagram, straight away you can see, without even knowing much about this, that this area here, ischemic heart diseases, is significant. And then if you add it to this area over here, there are other forms of heart disease that 5%, you're looking at 17%. That's really, really significant. So this is Australian statistics. I'll show you about the global statistics in a minute. Ischemic heart disease, for those people who aren't health professionals, we're talking really heart attack. We're talking about other things associated around that. So the next thing that we need to be mindful of is cancer. So we've got digestive organs. It's a significant number of people, 10% in Australia, experiencing these and actually dying from this particular group of health problems. There are others, and we'll go through it. But I just wanted to highlight that literally when you look at this, we are still, even with all of our chronic illness management, even with our public health forums in Australia, we are still not addressing heart attacks in an efficient way, which we need to do. So for men, this is something you've known that this has been a risk factor within your health, that a lot of men die from heart attacks, and we're still seeing 12% just from that problem alone. Let's have a look at that in more detail. So you can quite clearly see that there it is on the top of the pile. And so this is out of 100,000 people. You then can see that cancer is the next one. Now, this group of people are saying that literally in the number of deaths in 2016, and the reason this one is particularly important is because it's more comprehensive than the last slide. This 2016 is an Australian national survey. It's one of the best in the world. It's due to happen again, but this is the most recent reliable stats that we've got. So you see trachea and lung cancer is fairly significant, being the second highest leading cause of death for men. Now, the reality is I'm going to be interested to see if that's changed in this next round, because we know that one of the reasons is because of smoking, and we'll talk about that a little bit more. We know about dementia and Alzheimer's disease. We need to put that into perspective a little bit. Dementia is highly related as you age, both for men and women. So we're an aging population in Australia. Again, this is still talking Australia. And so you wouldn't be surprised that having dementia high up there and then dying from dementia or Alzheimer's disease is fairly high up when we're such an aging population. What's interesting is a lot of people think prostate cancer is a significant, like a leading cancer. It's not, it's significant. It's very significant. So I don't want to downplay that. But the reality is other cancers, in fact, are causing more death. One of the reasons is because we're getting the message out there that men really need to do preventative health care. And there's significant organisations like the Australian Defence Force who insist that all their men have an annual checkup. So what happens, you have young men actually being examined for prostate cancer, having blood tests and so on. They leave the military and they continue to have those preventions. If we could do that for every major organisation, prostate cancer would drop even further. So we know prevention, early detection, actually helps reduce the death rate from prostate cancer, which is why it's down there. The other thing I want to highlight is breast cancer down the bottom. Do not discount the fact that basically, people are men. Men still die from breast cancer, not as much as other issues, but they still die from it. And the tragedy of any deaths from breast cancer is because they usually don't think of that. They usually don't react. They don't look for lumps. They don't actually get any sort of tests. And yet we know that breast cancer has a significant genetic connection. So why aren't men considering, if they've had a direct family member or even a grandmother or an auntie pass from breast cancer, they should be considering that they too are vulnerable from breast cancer. But men don't tend to think like that. So we need to highlight that as something very important. So let's have a look at the top 3 causes of death according to age groups. So this has come from the Australian Bureau of Statistics. They are the best statistics in the world, and I'm very proud of that. We're very good at collecting data. We all know, well, most of us should know if you've been in Australia for a while, that we have consensus data. If you're in Australia and living in Australia, by law, you're obliged to fill out a survey on one day between this date to this date. So literally 24-hour period, every single person that's living in Australia is requested to fill out this survey. No other country in the world does it. So when we look at our statistics, we've got wonderful statistics, really significant information about workforce, about health, all sorts of things. So basically, this is really good statistics. Intentional self-harm, right at the top. And look at those age groups. And I'm sure Tony Walsh yesterday talked about suicide, because I said, are you going to talk about suicide? Because if you don't, I will. And he said, no, I'll talk about it. So this is really following up from Tony. It's very important that you look clearly at those age groups. So 15 to 44 is the leading cause of death, is literally intentional self-harm. What are we doing? What are we doing in Australia? What are we doing across the world? It is a real problem that this is the leading cause of death. You know, it really, when you see those sort of figures, you start to say, you know, this is preventable. This is something we should be working on. What is going on there? There's a few things going on there. I was talking before about some studies that I was doing looking at suicide in a regional rural area of Queensland. Now, one of the things in that region is that it's actually agricultural. And at the time, I chose that region to put this, train people and put this new therapy into this region, because it was at the time the second highest suicide rate in Queensland and the 4th highest in Australia. But basically, the numbers that were actually suiciding in that region, I'm talking Hervey Bay, the region of Hervey Bay and West, it was quite concerning, because it was quite a high number. So in reality, you've got a proportion of people that are retiring, going to the beach, and then you've got an agricultural community. So when we scratch the surface, there is in fact not all people who have actually successfully suicided in that region have depression, which is what everyone assumes is the problem. It is a problem, but there is an additional problem. The others that did not have a clinical diagnosis, and it appeared that they weren't depressed, they had come to the conclusion that in drought, and because they literally, their farm was doing poorly, their animals were really getting skinny and looking terrible and probably going to die, and they just didn't know what else to do. They didn't reach out for people. They didn't actually ask more questions. They didn't go to the doctor. They didn't share people have said that they had people who've attempted suicide and been unsuccessful have shared that as men, they felt a sense of shame that they could not look after their family. You know, stuff happens all the time. And so, you know, at times like that, we all can have hardships, both men and women. But we do need to challenge some of those traditional views of, if it's out of your hands and nature has intervened. It's the same with the bushfires. We're watching communities with the bushfires, and first it's PTSD, then it becomes suicide down the track when they're actually still not financially recovering and they can't see a way out of it. You've got to appreciate, in the rural Australia, if you're not familiar with it, you may not be able to sell your farm when it's in drought. So you can't even sell it. You may not be able to get your cattle to be sold. It will not get you out of that problem. So we now know, a good 10 years of research, that this community is a community we need to watch carefully. We also know that military, there is a lot of depression, and sometimes we know from those studies that have looked at military men that are both still current or retired, that we know that they also think that they're a burden on their family. So PTSD and depression were the two main mental health issues there. So there is a sense that there is this belief that everyone will be better off. That's not true. So we need to think about that a little bit more. Of course, it's no surprise that car accidents was the second one there. So let's have a look at this cause of death of intentional harm. And I wanted to highlight the other area was the 85-year-old and over. This is a new area of research that's poorly understood at this stage, but the early findings show that men tend to actually consider whether it's worth continuing on in life because they feel isolated once their partner passes. So we now are aware of that. So what does that mean? How do we engage men? We're not talking women here, we're talking men, remember. How do we engage men who've lost their partners? How do we help with that situation? The other thing we know about elderly men is that we have a number of cultures, not just Anglo-Saxon traditional type white Australians, but other cultures as well, that we don't handle the discomforts of aging. So rheumatoid arthritis or osteoarthritis, the pain, men don't typically take pain medication. Now, the issue of that is the pain escalates, and you need to actually do something about that pain before it gets to a severe point. So as they get more pain, they become more disabled, and they don't have a partner anymore. And, you know, again, it's like, what's the point of this? Well, the point is usually there are other family members that love this man. There are friends. Sometimes their friends are passing around their age. How do we connect these people? How do we get them back into the community, connecting with other men, connecting with men and women, not necessarily of their age, but people with similar interests? We really need to think about what we do there. Aboriginal and Torres Strait Islander, I can't talk Australian statistics if I don't just talk about this. No surprise, ischemic heart disease is right up the top with these people as well. But look at what's the second top in this. These are quite recent stats, not as good as the 2016, but they're quite good stats. So intentional self-harm, we know that's true. In Indigenous and Aboriginal Torres Strait Islander, we have suicide attempts when Indigenous men are jailed. So they actually may be in a domestic violence situation, or they may have been drunk and disorderly, and the next thing they've had an attempt of suicide. There's a lot of research going on in Northern Territory and Northern Queensland trying to get an understanding of what's going on there. But again, it comes down to that male pride, that male sense of shame, and we need to debunk some of these myths. We went through this 25 years ago with women when they had children, they had a baby and they developed postnatal depression. And the common thing that they said was they felt shamed that they had postnatal depression. Why? It's the same thing with this. If you're an Indigenous man and you've gotten drunk and disorderly and you've been put in jail, you know, it's not, you know, we don't want to see these men losing their life over something like that, but it does happen. Diabetes is an interesting one. In other cultures, whilst diabetes is increasing across multiple cultures, the interesting thing is that the management of diabetes has improved, but not so much in Indigenous Australian populations. So you have to ask yourself, what is it? Is it that their self-management isn't efficient? Is it that they have no access to health services? Is it that it's for some reason a vulnerability that makes it more severe in this particular population? The three theories are still current and it's still being researched. So it could be all three. So watch this space and off we go. Okay, so where does Australia sit inside the world? Surprise, surprise, ischemic heart disease is there again. So what does that mean? Well, it means many developing countries are unfortunately, instead of, you know, keeping with where their good nutrition is starting to enjoy the McDonald's being put up on the corner in their major cities and taking up some of the lifestyle of Western society, which is really, really a bit sad. As well as that, we are finding that people aren't as active as what they used to be. So we have changes in nutrition, they're less active. So in this case, we're talking about developing poor lifestyle choices. And in Western society, we talk about it as poor lifestyle habits. And unfortunately, more and more countries are starting to copy. It's because it's fast, it's cheap, and so on and so on. People who actually are poorer in the lowest socioeconomic groups, they really have a problem with this, because good food, when you compare, if you can go down the corner and buy a quick takeaway from McDonald's versus buying good food, actually is actually difficult. Some of the good food costs more. So there's a big global movement questioning this in Western society, not so much in developing societies, but in Western society, people are starting to raise the concern. I remember sweet potato used to be so cheap. It's slowly creeping up. That seems to be a bit of a trend in Western society, which is a bit of a pity. Okay, the next thing is the stroke. When you look across the world, you actually see that strokes are increasing a little bit more than in Australia, but it's still quite high in Australia too. But it's even higher when you look at the global trend. Interestingly, I want to point out tuberculosis. You didn't notice that on Australia's maps. It is there. Because we have immigrants coming in, we do have tuberculosis. So you must be mindful of that. Very, very important to remember. However, on the global trend, you know, it's a significant issue that we're watching. Tuberculosis is, it has not been eradicated, unfortunately. It was always believed it would be eradicated. Cirrhosis of the liver, interesting, used to be on Australian statistics, not so much now. It still exists and men still die from cirrhosis of the liver, way more than women, because men tend to drink more than women do. The liver is a really clever organ. It will rehabilitate itself, but if you keep excessively drinking, eventually it can't. So eventually this becomes a problem. There are some theories that show that there is genetic dispositions towards cirrhosis. It is not confirmed yet, but it's possible that some populations have a greater vulnerability for cirrhosis of the liver. Okay, so if we've got a big problem with heart attacks, let's talk about that. Because you know what? It's everybody's business to do something about this. So when I'm talking about this, I'm saying to the men, you've got to pay attention. I'm saying to the women, you've got to pay attention, because there is a male in your life somewhere. It might be a friend, it might be a relative, it might be a partner. We all need to be mindful of these issues that we could all do something about. So one of the things that is a little bit more preventable when we're talking about poor lifestyle choices, the big one here is atherosclerosis. So this is lipid deposits on the sides of your major arteries and other vessels, your blood vessels. There is fatty deposits that land, plaques that sit inside that vessel. So what happens with that? It actually starts to narrow the space that you have inside a vessel for your blood to flow through. I've drawn a rudimentary drawing, which we'll have a look at that in a little bit more detail. So ischemic heart disease also is an issue as you age, because on top of this fatty deposits that's laid down, your arteries and veins start to become less elastic and less agile. So where they are quite, fish-like movements, they become quite rigid. And so what happens is if you get a clot flowing down, not only do you have less size in your vessel for the clot to pass, but the artery or the vein doesn't have the ability to push it through, which it tries to do. So the issue is that heart conditions become more of an issue as you age as well. So let's have a look. Men, 35 to 44 years of age, 6 times higher than women to actually have an episode, either a threatened heart attack or an actual heart attack. And I can tell you, most men in this age group will not know. They'll end up going to hospital and having had a heart attack. What is the other scenario is that later on, they will go to hospital with chest pain and they'll be told, you've had a heart attack. Oh, by the way, when did you have the last one? And they'll say, I've not had a heart attack before. And I've actually had that experience where I've had a man say to me, but I haven't had a heart attack before. Yes, you have. And it was probably around this age, and they weren't aware of it. They might have fobbed it off, like discounted it and said they had indigestion. They may have felt a bit breathless and didn't really think. They might have put it down to stress, but they haven't thought to go and seek help. And interestingly, they've managed to get through that one. And why? Because their vessels, their arteries and their veins are more agile. So what happens with a heart attack? Literally, something blocks that blood flowing through, meaning that the blood's not getting to the heart muscle. And then suddenly that part of the heart muscle that actually has not received any blood will literally actually die. So that's what it is. If you smoke or if you have diabetes, you are 2 to 3 times higher likely to also have a heart attack. And if you have a first degree relative, so in other words, your sister, your mother, your brother, your father. So let's look at the males first. If it's your father or a brother and they have had a heart attack before they have turned 55, that is a significant risk to you. If it's a female relative, a sister or a mother, and they have had a heart attack around 65 or before, that is a highly significant risk factor for you. And then the ones on the bottom, which I will go through some of them later on very briefly, they may or may not lead to a heart attack. So you will see people educate you about not excessively drinking, not being overweight or obese, and so on and so on. But in actual fact, usually you have to have some of the other links to those risk factors to make this more likely. Okay, here's my rudimentary diagram. But if you can see that, you can see the yellow plaques that I've put inside the vessel. And here comes the clot. And suddenly you've only got this little tiny area to come through. And that's why you'll suddenly get pain. The muscle in the heart will scream, oh, I haven't got enough oxygen. Oh, something's going wrong. I need oxygen. And of course, the tissue may or may not die. If it dies, it's considered a heart attack. Which country do you think may have the lowest risk of heart attacks? Anyone want to have a guess? Anybody want to have a guess which country in the world has the lowest heart attack rate?
It's not Japan, is it?
It is Sweden and Japan. Do you want to have a guess, David, why they think that's the case?
Hmm. Something to do with people's diet and lifestyle habits?
People, particularly diet. So our good old fish, they are suggesting that that's the reason. I have a friend who actually, women are protected by estrogen until they go to the menopausal period. And out of interest, guys, at that point, when you've gone through menopause, your risk for cardiovascular disease is exactly the same. So your risk for having a heart attack is about the same point as men. It's a little bit lower. But I had a friend that did a massive study, and the study in Japan showed that they had a lot less, and their diet was significantly wrapped around fish. So that's certainly being taken seriously, and more work's happening in that area. Stress. How does stress work? Why do we keep talking about stress? You can be very stressed and not have a heart attack. I need to say that. But the reality is that stress does give you lots and lots of health conditions. And there is a link between stress and obesity. There's a link between stress and high blood pressure, and so on and so on and so on. So they're all related to heart attacks. So when you actually are in a stress mode, fright and flight, literally adrenaline kicks in, and basically everything changes inside your body. And one of the things is the arteries narrow. After a while, adrenaline is all used up, so another hormone needs to be used, so cortisol kicks in, and that means you've got a heightened state all the time, which means if you're vulnerable for heart attacks and your arteries are smaller, your coronary arteries that feed your heart muscle may in fact narrow and then get a clot, and boom, you've got a heart attack. Something worthy to remember, panic attacks can be exactly the same as the symptoms of a heart attack and may be confused. So what? Go to hospital and be told you have a panic attack? Thank goodness. In fact, Doctors and nurses sometimes use black humor, and they sometimes accidentally come across incorrect. So sometimes you'll see them actually almost laugh and go, "Oh, thank goodness you've only had a panic attack. Oh, what a relief." And then the person feels silly, and they don't mean the intention. They're so relieved that it's a panic attack. But you know what? Panic attacks can be disabling. So we want that to be addressed too. So, you know what? If you get these symptoms, you just go and get some help and work out what it is, and then get either one managed. It's very, very important. Okay, so basically, I said before, if there's no death in the heart muscle, then you just get the chest pain. For those that don't know, that's called angina. So you'll hear someone say, "Oh, I've got angina." Well, hello, that could lead to a heart attack one day. So that needs to be taken seriously. Men need to understand what that pain is. It's anything from around the jaw right down to the bottom of the rib cage. It actually can be going down the left arm. That's referred pain. That's significant. But there's also other symptoms. Literally, that notion of dizziness. You don't have all of these, by the way. Men describe the pain differently too. They may say it's crushing. They may say it's severe. They may say they can't get their breath. So you can't assume that the pain is described the same way. So if you've had a friend that you know, or an elderly relative that's described having a heart attack to you one day, don't assume that the way he describes it will be the way that somebody else will experience that in that family. So we need to be open to this, that these symptoms, that chest pain, really that person needs to go and get some attention. Stroke. Strokes are, something that we really need to pay attention to. I mentioned before, increased blood pressure is related to strokes, and strokes are related to cardiovascular disease. Here's cholesterol again. I mentioned the fact that we had atherosclerosis, which is basically talking about cholesterol. Remember, you've got good cholesterol and you've got bad. But if your bad cholesterol is a high rating cholesterol, that is the one that leads you to heart attacks and strokes. Diabetes is related to strokes. Diabetes is related to heart disease. Diabetes is related to depression. Depression is related to heart disease. There are bidirectional relationships. If you have one, you're more likely to have the other. People need to note this. Very, very important. Smoking. Here it is again. Smoking. How do I know it's a stroke? Well, this has been an Australian initiative. It's now a worldwide initiative. You use the term FAST. So face, the lips droop, your arm, put your arms up and one falls down and the other one stays. That's a sign that maybe you've had a stroke. Speech. Some people think you have to have slurred speech. If it's just different, then go and seek help. And timing, O, straight away. But also, if somebody thinks of it, note the time, because someone will ask you, when did you first note these symptoms? Keep the person warm. Really, really important. Keep the person warm until they get there. Even in summer, you'll probably have to cover that person. There is a debate about aspirin. Remembering I mentioned clot, but the other thing that can happen in strokes is that the walls of the vessels start to become a little weak and they can burst, and suddenly you've got a cerebral bleed. It causes the same thing of stroke. So literally, if you have a cerebral bleed, aspirin could be dangerous. And yet, if you have a clot, it's incredibly useful for stopping it getting bigger and bigger and bigger. The latest study was done in 2017, and they concluded, it was a good study, that it was probably better to give aspirin. At this stage, though, I would recommend that you carefully watch those results, because, they keep changing the guidelines. But that's an interesting thing. All I'm going to say is, look at that statistic. Cigarette smoking by far is the greatest cause of trachea, so the windpipe, and lung cancer. Why are we not hearing this? Why are we not listening to this? And that men are encouraged to give up smoking, particularly in Australia. We have so many aids in Australia that are free, that the government provide for this very reason. Okay, type 2 diabetes. I'm sure a lot of you are aware that type 2 diabetes is put down as things that can be prevented. So we're talking poor lifestyle habits here, but we're also talking stress. And a lot of us in this industry have a lot of stress, whether we're academics or whether we're professional staff. So we need to be mindful of that. I just wanted to highlight race. The Indigenous race of Australia is highly likely to develop diabetes. What about South Asians? Well, guess what? They're at about the same level as what the rest of Australia is. So not Indigenous Australians, but the rest of Australia, that basically they're at that same level. So what does that mean? That means their habits are changing. And that's disappointing to think that diabetes type 2 is on the rise in South Asia. So basically, that should have said South Asians. My apology there. Okay, so what does all this mean? We're meaning making. Many of these things and are causing the greatest deaths in our men actually could be preventable. What are we doing? You've got to ask yourself, what aren't we doing? What else do we need to do? Because we do need to address this. COVID-19 has pretty much said to us that you can have infections that can cause great death, and that's scary. But this is worse because more of our men are dying from preventable problems. So we really need to keep our eye on the ball to do something about this. How do we get those risk factors down? How do we let men that are feeling vulnerable, let them speak out? How do we do that? How do we get the awareness going from being aware and giving permission for people to talk about it, doing something about it? Remember, heart attack 6 times more likely between 35 and 44. How many men at that age would go routinely to a doctor and get that checked out? They don't. So they're more likely to have their first episode of a heart attack merely because they have no idea what's going on. They haven't had their blood tested to see of their cholesterol. They don't know they've got high blood pressure. And remembering that even a child can have a stroke, even a child. So men in that age group still do have strokes as well. So how do we prevent that? It's more than just eating right. It's about addressing our stress. And it's a bit of a pity we may not have the mindfulness. How do we let men who are feeling vulnerable speak out? Well, you know what? It may be that people don't want to speak out, but when we're working with people and we get to know each other and we think somebody's different, why don't we, whether it's men and women, just say, hey, you seem a bit different at the moment. Are you okay? That is why the Are You Okay was designed, to speak out. But you know what? It's not enough to do it one day a year. We need to do it for each other every day of the year. Okay, thank you. Any questions?
Hi, if anyone has any questions.
I've stumped Bodhi. They're all going to rush out and get their blood test done, and they're all going to rush home to their male partners, and they're all going to rush home and insist that they do this, that, and the other.
I think that was a very wonderful session. Thank you so much. Thank you so much, Dr. Jenny, for that. We really, really thoroughly enjoyed it. Now we have Beston with us here, and he will
he is there. Excellent.
We will be conducting a meditation session. Is that okay?
That's wonderful. I think we'll all need that now.
We do need it. I'm feeling quite worried now.
Okay, so David, all you need to do is say, okay, in my life, what can I do to address that as a starting point? And what do I do to manage my health? Yeah, and look, I'm one of the worst ones managing my health. I'm not gonna lie. I am not great, which is probably why I specialize in chronic illness. That's one of the things I specialize in anything over long term. You know, how do people adapt? How do we get them back to being healthy? And so, you know, people with mental health problems, is when it becomes chronic, is a fascination of mine too. And I guess, you know, it started off with the curiosity about yourself. You start reflecting on what you've done. And a lot of this is how we've actually been raised, you know, the messages we've got, you know, and also the messages we've got from you know, the world along the way. We haven't really had the last 20 years clear messages about what is the good things to eat, what is not the good things to eat. You've got the health industry constantly, you know, encouraging us to do things, and yet there's not always evidence there. People are trying to get that evidence, trying to get research done, you know, but the reality is it's actually an evolving understanding that we've got. But let's be truthful, you know, chronic illness, the messy ones, obesity, depression, these are the wicked problems of the world that we've got to deal with.
Thank you. Thank you so much, Dr. Jenny, once again. So now I think meditation would be the perfect end to this week.
Perfect.
So now I'll hand it over to Beston and he will take over. Thank you.
Hi everyone, my name is Beston. For those who don't know me, thanks for the opportunity to speak. And yeah, thanks for the presentation before. It was insightful and equally harrowing hearing about the prevalence and yeah, all those chronic illnesses. And I guess as you just touched on, there's a lot of messaging around what to eat, what's right. And equally, there's a lot of marketing and pushes that just, you know, sway our decision making. And I guess, so I'm studying to be a dietitian at the moment. And on the side, I'm a meditation facilitator. And I believe the two definitely intersect in that mindfulness can help us break through some of the fog and be more in tune with what our body needs, essentially, in terms of eating and what makes us feel better and whatnot. And essentially, in my opinion, our long-term health is made up of small decisions made day to day. And so if we can be more in tune and make slightly better decisions each day, then those chronic things can be either mitigated or hopefully hopefully avoided. So I've been invited to talk mainly about meditation, but I guess I'm equally interested in the food side of things. So we'll start off with the meditation stuff and yeah, really sort of, I guess just check in and sort of take a moment out. So today we'll do about a 10 to 12 minute meditation. And if it's your first time, I guess, one second, let me just close the door, a lot of noise. If it's your first time, meditation is quite it's different to what we usually do in the normal day, in that like we're just taking a moment to go internal and just check into all of the things that are vying for our interest and our attention. We're not trying to change it per se, but we close our eyes, we notice our breath, we notice any emotions running around, thoughts, pretty much, yeah, the five senses and a bit more. And all we're trying to do is notice and acknowledge all the many things happening within at the moment. So that's a very brief summation of what meditation involves. I'll be saying some words. You guys try to follow along. If you get lost, just try to pick up in the next one. The key point, I think, is try not to judge yourself. If it's your first time, like it may be difficult. Like if it's the first time you're doing this whole meditation thing, go easy on yourself and approach it with a sense of curiosity. Curiosity is, like, my opinion, the number one value we can cultivate to have a successful, or not successful, like a fruitful mental health. Because when we're curious, we're sort of interested, non-judgmental and accepting of whatever it is that's happening. And when we come from that place, we can have a more fruitful insight into what's really affecting us and what are the right course of action we need to take. So yeah, without further ado, we'll slowly warm up into the meditation. So firstly, I invite you to find a comfortable seat. So maybe you'd like to adjust your chair, change your posture a bit, and it helps to have your chest open. Yeah. And I hope the noise from here is not too bad. It's a bit loud for me, but I hope it doesn't come across on Zoom. Either way, we can bring the sounds into our meditation. So we'll be going for about 10, 12 minutes. Hope you're comfortable wherever you are. And just rest your gaze somewhere on the wall in front of you, maybe picking a particular color to look at. And now soften your eyes. And in your own time, when you feel ready, let your eyes close. Take a moment here to just double check that you're as comfortable as you can be. Maybe you can wiggle around a little bit in your chair. And just sink in ever so slightly. Start to connect to your breath. Making your breath a little bit deeper. And take a few breaths out through the mouth. You can be as loud or as quiet as you want with these sighs. Each time you breathe out, allowing your body to be at ease, sinking into the chair a little bit more. And let's start to notice the many sounds happening around us. Jumping from sound to sound. Purely taking in the auditory sensation. Observing the sounds outside the room you're in. And now the sounds within the room you're in. Maybe you can notice that moment when your attention jumps from one noise to the next. Curiously observing as your attention skips along. Moving a little bit closer, maybe you can hear the sound of your breath. That raspy noise as the breath flows in. What's the speed of your breathing right now? Deepening the breath, filling the belly up with air. See if you can find that moment at the top of the inhalation. So right when your lungs are full capacity. That brief pause before you start breathing out. Once again, putting on that lens of curiosity, gently moving your attention to your fingertips. Noticing where your fingertips are resting. What textures can you feel along your fingertips? Maybe it's the fabric of clothing, the soft plastic of chair. Noticing any sensations you can feel along your fingertips. And if your attention jumps around, acknowledge where it's gone to. Maybe picking one or two words to label what's holding your attention, whether it's a sound or a thought. Gliding your attention over to your chest, somewhere around the sternum. So right in the middle of your chest. Feeling the slight pulsing of breath here. Chest expanding and contracting. Take a few clearing breaths out through the mouth. Sighing out gently and softly. And let's take a moment to just check in. Just asking yourself, how am I feeling right now? Seeing if you can notice a few things. And once asking yourself, am I feeling different to 10 minutes ago? Take a few more big breaths. In your own time, start to bring some gentle movements to your body. Maybe wiggling the toes, shaking out the fingers, whatever you feel called to. And you can open your eyes in your own time. I never know what to say right after a meditation. Yeah, I'm curious to know how you guys went, and especially, do you feel any different to 10 minutes ago? If you feel comfortable sharing, feel free to unmute yourself or just put it in the chat. So that was a pretty, quite a simple meditation, I hope. There was a lot of noise going on here, which I personally was struggling with, so I feel for you guys. I try, like, noise, we can bring in noise to meditations. What you try to do is just sort of notice it, and rather than thinking about the sound itself, just purely the auditory sensation, and you just allow your attention to jump and jump, and as you're doing that, you're basically checking in and sort of sitting with yourself. Yeah, any questions about meditation? Or no, you bet. Any questions, comments? How do you feel? Confusion? Happy to clarify.
I will start. I have to say that, I've done meditation before, and I've gone into the jelly mode.
Mm-hmm.
And partway near the end, I was thinking, oh no, I've got to finish an MOU. So I tend to personally find 10 minutes very long. I get into it quickly. I didn't find the noise distracting at all. It was noticeable, but not distracting for me. And actually my chocolate Labrador came to me to check on me near the end. So, I really enjoyed it. But from a personal perspective, I find it really hard to think to do it. And I do find it, I'd be interested to know what they say with the evidence. Why do people spend that 10 minutes? Can you get the physiological response quicker? I wonder,
Yeah, I always feel the hardest part of meditation is actually sitting down. You've pretty much won half the battle if you manage to get yourself to sit down. I know I personally struggle if I want, like, in the mornings, I've created a habit out of it. I just breakfast is time to sit. But the evenings, even when I might need it more, when I'm a bit more flustered, the day's wore me out. It's like, well, I could sit down, or I could just indulge in something else. Yeah, about the evidence, I'm not too sure, but I personally feel like 10, 15 minutes you need minimum to be able to get those benefits. It takes a little bit of time for our like nervous system to catch up and adapt to the changed breathing patterns. So I do know that like 6, 7 breaths is like maybe like a minimal effect dose. So if you're feeling super flustered or something like that, or you're going into a high pressure situation, taking like 6, 7 big deep breaths can go a long way. But actual like long-term physiological changes, I think maybe at least 10, 15 minutes a day. Yeah.
It's interesting that our pets are so drawn to us when we become calm and meditative.
Approaching.
That too. I've been aware of meditation most of my life. I started learning about it when I was maybe 11 or 12 years old. And yet I find that I rarely do it. And I think that's very sad. Do you have any advice about how to, I don't know, like just make it part of your life and things like that?
Yeah, definitely. So I don't know if I just lucked out, because when I first stumbled across it, I was like, I need to do this. Holy moly. Like, this is it. This is the fundamental thing. But a few things that helped me out was like setting up, like, get a nice cushion or chair or corner that is your like meditation corner per se. So having like that environmental thing, like when I'm in this space, like, oh, this cushion, this is my meditation cushion. And it gives you like a trigger, like, okay, I move there and then I start doing that. For me, what helped was setting up in the morning that like as soon as I had breakfast, the very next activity was meditation. And I understand time is hard to come by. And so it's just I guess inquiry about what do I get out of it? Maybe taking taking a little session to just write down your whys for doing it and putting that in a clear, like visible eye level place. Stick it up, like, why do I want to meditate, and write a handful of reasons that mean something to you. And so having that as a reminder, with the visual cue, could definitely like just prod yourself a little bit more. Yeah, I think that'd be my main tip. Really taking a moment to write it down and put that somewhere easily viewable. So when we feel like, you don't have to call upon your willpower to get through all that thinking in those moments. Because willpower is a fleeting thing. Yeah. Another, I guess, making it a habit is a bit of work. Another thing I did when I started was like I've made this. It's just like a table with 7 boxes across, and so that's 1 week. So each day I did it, I'd just make an X on there, and that was also in a eye level place, so that I could see that I'm building this habit, and it sort of gives I felt good doing those ticks, and then I wanted to get the ticks the next day just as much as I wanted the benefits. So that kept me moving forward in a way. So my 2 tips is write down your whys, and some sort of habit tracking mechanism that works for you, whether it's on your phone or on a paper. Yeah, it's quite simple, but it's getting yourself to do those things.
Okay, so, sorry.
Go for it.
Sorry, you were saying something. Okay, so one of our viewers on our Facebook, YouTube live, he just mentioned that he found it very insightful, and the noise around him was perfect, and it actually helped him to meditate better.
It's wonderful to hear. That's I appreciate it when people are able to take in noise in a meditation, especially when you're starting out. If you're already able to bring it in and just be accepting, that means you're doing well in terms of like the lens that will help the practice grow over time.
I think noise doesn't have to be our enemy. But often we assume it will be, and therefore we worry about the fact that there is noise, and that can be a distraction. But one of the things that they taught us at high school was to study under noisy conditions and things like that. I can now go and sit in a shopping centre and I can read a book or that sort of thing without finding the noise an issue. what they did was that they asked us to memorize a poem. And they said, we're going to put the poem up on the projector for 1 minute, and whoever can memorize the most lines and recite them afterwards will get a prize. And so for that minute, while the poem was on the board, all of the teachers, they played loud music, they threw things at us, they waved underwear in the air, and and tried to get our attention any way they could. But yeah, I thought that was a very, very useful lesson. And they said that is what life is like, and that's what it's going to be like when you are trying to do your VCE. That's what we were leading into at that time. But like when you're trying to do your work or your university course or anything else in life that needs focus.
It's definitely an interesting way to prepare you, but I guess a good lesson learned early. Make noise a friend and just accept it for what it is. And yeah, acceptance is a big part of what meditation is about, because often things that are stressing us out are things that we may not necessarily be able to instantly change, but like through thinking, sometimes we just feel, all right, if I can just think this through and just somehow get to that solution, it'll be a bit easier. But when we find we're at an impasse, it's just like it can blow over. So building acceptance of what we can focus on in front of us and taking the action necessary. Acceptance comes first so that we can actually focus and put our best foot forward, essentially. So that's acceptance and curiosity. They're the two qualities I try to emphasize when bringing meditation. But yeah, that's, I guess, all of besides to getting yourself to sit down in the first place. If you are interested in continuing to practice, I'm actually doing a live stream every night on Facebook. Not on the weekends and Fridays, but every other night. I've set up a Facebook group that's public. I'll give a link out to Bodhi and she can send out email with that. So that's on every night at 8:30. I started it during quarantine because I figure everybody's at home anyway. So just thought I'd push something. Yeah.
Yes. Anyone else wants to ask Beston any question or anything else? Okay, I think no one. So I think we can conclude our celebration of International Men's Health Week here. Thank you again, Dr. Jenny, and thank you, Beston, so much for giving us the time. Thank you again, and we hope to see you soon then. Thank you.
Thanks for the invitation, Bodhi, and stay well, everybody.
Yes. Okay, thank you. Bye-bye.
Bye.
Thank you, guys. Have a good one.
Thank you. Thank you all very much. Thanks, Bodhi, for organizing it. It's been very good.
Awesome. Bye, everyone.